Hi there. Welcome to today's episode focused on dementia caregiving and how to prepare for your own health crisis. By the end of this video, you're going to learn 4 things that any person caring for a person living with dementia needs to know, just in case you end up having your own health crisis. Because whether you're a seasoned caregiver or just starting your journey, you need knowledge and tools to empower you to handle your own health crisis with confidence and compassion. So welcome back to all of my subscribers, and particularly my YouTube members and my HYSU members. We've built an amazing community over the past 4 years. And if you're new to the channel and the podcast, welcome to This is Getting Old, Moving Towards an Age-Friendly World. I'm Dr. Melissa Batchelor, and I am a nurse and a nurse practitioner with nearly 30 years of experience caring for older adults and their families. I am inviting my HYSU members and my podcast insiders to join me for the live recordings of the podcast. So if you'd like to join me for our future podcast recording, stay tuned to the end to find out how you can join me for these weekly live events. And the reason I wanted to focus on this topic today with Jacob is because caregivers of a person living with dementia need to actually think about what they would do if they experience their own health crisis. Like, who's going to take care of that person if you land in the hospital? So it is something that I think you need to think about and prepare for just in case something happens to you, because being prepared can significantly decrease the burden of a tremendously stressful and difficult time. Well, welcome, Jacob. How are you today?
Yeah, hey Melissa, I'm doing well. How are you?
I'm good. So today we're talking about dementia caregiving and how to prepare for your own health crisis. And the reason that I wanted to talk about this topic today with you, this is Jacob Kendall who's joined me, is because caregivers of a person living with dementia really need to think about what they would do if they experience their own health crisis. And we're here to help you think about the things you need to prepare for just in case you land in the hospital, because being prepared can definitely ease the burden of what's going to be a difficult, an extremely stressful time already. So we will dive into dementia caregiving and how to prepare for a health crisis. Welcome, Jacob. And before we get started, maybe you could just introduce yourself.
Yeah, thanks for the opportunity to have a good conversation. My name is Jacob Kendall, and the 2 things that I usually say when I'm introducing myself or doing a talk are, one, that I very proudly have a broadly interdisciplinary background, or basically training in several different fields: gerontology, social work, public health, and currently theology as well. And I'm mostly focused on aging. That's my PhD is in gerontology, study of aging. And so basically, I much prefer to have broad training, be a jack of all trades rather than expert of one. And so I like facilitating dialogue across different subject matters or different disciplines. And then the other thing is I've had 2 open heart surgeries and lifelong complex medical needs, hundreds of encounters with healthcare providers, both as a patient and as a caregiver. So I combine those 2 things in what I do now, speaking and consulting on for patients and caregivers.
All right. And where are you based out of?
I am across the bay from Mobile in Southern Alabama.
Okay. All right. Okay. And just wanted to remind people, we have people joining us live in the private podcast Facebook group. People have also been, if you're a podcast insider, you were sent a link to to Zoom to join us. There's about a 20-second delay if you're in the Facebook group, but I'll be trying to keep an eye on the comments for us. But in either location, you can add a question, leave a comment, and even on YouTube, you can do that in the comment section for us as well. If it's a question for Jacob, I'll make sure that he sees that and he can respond to it as well when this episode is posted there. So maybe, I guess first we should talk a little bit about, a person that does provide, caregiving, and particularly to a person living with dementia. What are some of the different ways that their own health can be impacted?
While I do focus on patients and caregivers, I will say that I was trained by a demographer, and I really like macro perspectives. And so I'm always going to come at any question with that in mind. And I think there is something interesting here from more macro or epidemiological perspectives when it comes to caregiving. One of my favorite things to say, because it's just so interesting and important to keep in mind, is, first of all, people who are family caregivers have higher morbidity and mortality compared to people who are not caregivers of the same age and gender, et cetera. And then among caregivers, people who are an informal caregiver for someone with dementia have even higher morbidity and mortality compared to people who are caregivers of folks with other kinds of conditions. And, that's one thing. And I think that when we realize that that's the case, we got to start breaking it down. And it's not just physical health. It's not just mental health. It's social health. It's financial health. It is all, it's all encompassing. None of those happens in a vacuum. And anything when it comes to caregiving is going to be amplified when it comes to dementia because of the very unique challenges with that at the individual level, at the medical level, and even all the way up at the population level. So there's a lot to unpack there. But that's kind of one thing I'll say to kick off this conversation.
Right. And I think part of the reason for that is that with other diseases, I think people kind of understand heart disease or diabetes, and there's a little bit more education and training. It doesn't necessarily change that person's personality, and it certainly doesn't necessarily increase their safety risks. And so I think that is what adds the extra stress and burden on caregivers, in addition to not necessarily knowing how to have or orchestrate or put together support, like to create a care team. And I know I've done another episode about the importance of building a care team, and it's for this exact reason. You need to have people that can come together if something happens to you, because the person with dementia is living in the present, so they're not really worried about anything. So all that burden falls on whoever that caregiver is. So what do you think are some different ways that people could kind of become a little bit more emotionally prepared for the fact that something could happen, or like how do you kind of get ready in case something were to happen to you?
You're talking about before someone falls into a caregiving role, but before that point, is that what you're asking?
Yeah. So like if you maybe your loved one has had a diagnosis for a couple of months, and maybe you're brand new to this, and everything's fine right now, but kind of looking down the road 5-10 years from now, most people I think are so focused on the person with dementia that they're not there's not really a concept or an awareness that you could have something go wrong with you.
Oh yeah. Okay.
So
yeah. Well, first of all, to start my response to that question, I'll step even farther back. It's why I clarified it for you. We Americans are terrible at planning in advance. I think people should when they get married, or when they start having children, or when they hit, their working lives and are in earlier adulthood, they should go ahead and start thinking about have a will, have life insurance, and have these other things start adding to an account that's going to be for this purpose moving forward. My papaw, he actually just died last week at 97, and several years ago he was caring for his wife with dementia, my mamaw, and he didn't have all the financial planning for it. Even though he was an accountant, he did our taxes for many, many years, and that was the job that he did. But I remember him saying one point, like, I didn't even expect to make it to this age. There was no reason he thought to plan to live until 97. And that's how a lot of people in that generation are. But now we know better in the younger generations. Now we know, listen, more and more people are going to live longer. And so we don't have an excuse to not go ahead and be thinking about those things. Now, the question that you asked, to be fair, was when we're already at that point in the early stages of a cognitive impairment or dementia, how do you plan for the next few weeks, months, and years? I think it's several things. One thing that I always say to caregivers is that you aren't any good to those you're caring for if you yourself are not have some reasonable level of health. Because there's this notion that there's almost a badge of honor in sacrificing ourselves on the altar of caregiving. And there's this sense of having pride or maybe embarrassment at it, and we don't ask for help, but you have to just prepare yourself. When you reach the point of realizing, oh, my responsibilities are going to increase because of this diagnosis as a caregiver, go ahead and start preparing yourself to build your skills of assertiveness, right? There's this idea that, well, what the doctor says is biblical truth. No, be prepared to be assertive with your providers, and assertiveness is a skill. So work on it, right? be prepared to be okay with asking for help. I usually use churches as an example, but fill in the blank. So if you're a member of a church, there are things that you can ask for as far as social and instrumental support are concerned that don't have to be a great burden on other people, but they're really helpful to you. So one idea that's it definitely has worked with churches I've been a member of in the past is go to your pastor or go to the person who does the care committee or whatever and say, hey, can we set up where different families contribute meals and we get meals twice a week or 3 times a week? And so they're spreading their burden out across many members, but it's really helpful to you. Like, be prepared to ask for those things. I just don't think that we don't do that enough, right? And again, it's a lot. It's either pride or embarrassment. There's some statistic I saw recently, like almost half of employees who are caregivers don't mention it at all at work out of embarrassment. So that shows the kind of mindset that caregivers have. But you need to go ahead and start preparing yourself to listen, do things that might make you uncomfortable, but it's going to pay dividends for you when things get really tough. And again, I'm naturally a assertive person. Some people would say confrontational, but not everyone is. This is a skill, right? If you find yourself being nervous at the idea of going to your doctor and pushing back a little bit and asking these tough questions, then know that this is something you're going to have to work on. If you find it hard to ask others for help, and you mentioned a care team, have advocates in your life. If you find that you're nervous about that or anxious about it or whatever, then you can go ahead and prepare yourself to start building those skills because you will need them. So those are some things that come to mind. And yeah, I mean, there are all kinds of things we could discuss, but those are a couple of things that come to mind.
Yeah, I think that one of the hardest parts about being a caregiver person living with dementia, and really it should be the same for any chronic illness, is that all the uncertainty. Because you've seen one person with dementia, you've seen one person with dementia. I had my monthly live Q&A with my HYSU members yesterday and was actually talking about this with them, and the fact that, what works today might not work tomorrow. And, but I mean, that's one thing. The other thing is, you could be talking to someone else who's providing care to a person living with dementia, and maybe they have Lewy body dementia and your loved one has Alzheimer's disease. The care that goes into those 2 diagnoses is still the same, but what you're dealing with at any given time might be slightly different. So I think, learning as much as you can about this disease is really important, but also realizing that it's not like from day one of diagnosis, this is what's going to happen in the first 90 days. And here's what's going to happen in the first year. So you actually have to try to live in the present moment as well. And I was talking to another HYSU member a couple of weeks ago, and he was saying, it's basically like dying 1,000 deaths, because every day something might slip away, then it could come back, maybe for a little bit. But it's more like people look back over 6 months and they're like, wow, a lot of things have changed. Or in 6 months, they have to kind of pivot around kind of, either altering care, getting more support, more care and support in the home. So I think, the analogy I gave yesterday was, life is really basically like a road trip. And I heard this on another podcast. I was like, this is a really great way to think about dementia caregiving. The windshield is big for a reason, because you do need to stay focused in your present and on your future. And that's why the rearview mirror is smaller, because if you're looking back, I mean, there is grieving that goes in to this, because that person is changing, and their personality is changing, and their physical health might stay okay for a while, but when someone's personality is changing and it's more difficult to get along with them, or they're repeating themselves, or they're asking questions you don't know the answers to, that can all be frustrating. So I think just kind of thinking about it, you're on this road trip and you should expect potholes, you should expect detours, you should give yourself permission to pull off on the side of the road and kind of say, okay, I'm lost, I don't know what to do, who can I call to help me, what are some of the resources that are out there, and making sure that you've built a care team, of family, friends, neighbors, community support, like you said, to help you with all of this.
Yeah. Um, for sure. I like that you mentioned, being okay with occasionally pulling off the road. The way I usually word it is practice grace on yourself because you're not always going to get it right. You're going to get frustrated. You're going to get impatient. Dementia it's a tough beast. And it's probably tougher on the people who are caring for those who have it than it is for those who have it. In a lot of ways. And so I like your language there. Be willing to practice grace on yourself. If you have to step away and have someone come, take your place for a little while, that is okay. You're not abandoning your post. You're making yourself better to be there for that person. So definitely be prepared to practice grace on yourself. One thing I'll always recommend is look on. I'm a member of some health related groups on Facebook, and I don't know all the ones that are available for dementia, but I am betting very strongly that I bet a lot of money that there are different groups for the different types of dementias, and groups for caregivers of those with them. Find those groups, and it's a give and take relationship. I have found it personally. The one that I spend the most time in is for people who've had their valves replaced, their aortic valves replaced, like I have in the heart. Um, I've found it helpful not just to ask questions and get responses to those questions, but for me to answer other people's questions and be truly a part of a community. It doesn't even take that much of my time. I get on there a few times a week, and I can spend just a few minutes there, and it's still really valuable. But I found it valuable to be both a giving and taking member of a group like that. And I totally recommend people who are caregivers to find those groups, whether it's Facebook or some other social media group, or maybe there's an in-person one in your community that's really, really valuable. And not just join the caregiver ones, but join the patient ones as well, because the farther things go along, the caregivers themselves have to think like patients because they're the ones they're caring for aren't capable of doing that. So that's another thing is as a part of your care team, it doesn't just have to be people that you know personally. Find these online communities or whatever, and those can be really valuable.
Right. And the podcast actually has a private Facebook group that anybody listening is welcome to join and to ask questions. I keep an eye on it. So far, we haven't had a lot of engagement there, but there are other, like you said, there are other groups, and I'm hoping that we build in a little bit more engagement in the private Facebook group for this podcast so that I can help answer those questions. But like you said, they can rely on other people who are experiencing it. And I think there's a blend of both caregivers, patients, and professionals in this group. So it makes it a little bit different. And the other piece that you were talking about, the reason it's so important to ask a question to a group like that is because if you've already exhausted everything that you can think of to do, it's always helpful to ask somebody else how they've handled that situation, because it could just be one suggestion to say, I tried this, because a lot of dementia caregiving is trial and error. And so you have to expect the errors. Like you said, have grace on yourself, because and to understand that what you tried and what worked today might not work tomorrow. And so you really have to be flexible. And the way I tend to describe, particularly Alzheimer's disease is, if you're the caregiver, your brain should look like a healthy grape. It's plump, it's juicy, all the messages can get back and forth, the brain is functioning. But a person living with Alzheimer's disease, their brain is beginning to shrink and shrivel, and they're starting to look more like a raisin. So they don't have the problem solving or the judgment. And so that person's really doing the best they can every day, and they're not doing these things on purpose to upset you as a caregiver. And so I think how we respond to the person living with dementia instead of reacting to them really makes a big difference with your own health. And so I think the more you understand, the more support you have. And, like you said, in person is good, online, because you might have a question in the middle of the night, those are all things that are going to help.
Yeah. I mean, you're right. You're trying everything, and there are hundreds of thousands of different types of experiences out there that people have with dementia or caregiving for it. And you can't possibly think of everything. And I found that sometimes a really simple thing that I'm like, dang, why did I not think of that? Ended up being literally a lifesaver. Or I might give that to someone else and they're like, wow, I'd never thought of this. So even small questions can really go a long way.
Yeah. And I would say from the problem solving perspective, you mentioned at the beginning of the podcast that you really liked kind of an interprofessional, interdisciplinary, like broad, types of perspective. I can, share a story. We had a resident in a facility. She wasn't, she had a mild cognitive impairment, but she was fiercely independent. She was also super hard of hearing, and she wanted to keep her television cranked up as loud as it would go. She wanted to keep her door shut, and but she had fallen a couple of times, and so the facility's answer was like, well, let's just restrain her. And I'm like, why? Like, she's not. I mean, she's just trying to be a human being and maintain her dignity, and independence. But when we said there's got to be some type of alarm. You have the mat that you step on. It will alert people that she's up, and we can just go in and help her. But the problem was with the door shut and the TV on, you couldn't hear it. So we got the handyman involved, and he just ran a little speaker out to the outside of the door, like a little doorbell. So when she stood up on that mat with the TV on and the door closed, the sound went into the hall so that the staff could hear her. So it's that type of thinking outside the box to have that person's needs met, but also maintain their safety. And so sometimes just talking to different people to say, this is a problem I'm trying to solve. Do you have any different ideas?
Yeah. And I think that's half of it, is learning what these ideas are. The other half is advocating for it to get done. Because whether it's facilities, the workers there are exhausted. When you're in a hospital or you're working with discharge, like nurses and physicians don't know they don't know these things, and we probably shouldn't expect them to. And then I wish that, being a social worker, I very much wish that it were a better situation for medical social workers, discharge planners, et cetera. But they're often really backed up as well. So learning to advocate for yourself, and like, hey, listen, let's try this, or I need to do this, or no, I'm going to make sure I get an answer to this question, kind of thing. So yeah, half of it is learning what the idea is, and the other half is advocating for yourself. And again, I totally acknowledge that a lot of people are uncomfortable with that. This is a skill you're going to have to build.
Right. So now let's talk about just some basic, like, practical suggestions. So if you are a caregiver of a person living with dementia, and you have a scheduled surgery that about, at least in that way you have time to prepare. But what could people be doing in case they don't have time to prepare? Like, for me, the first thing I'm thinking of is, making sure that you have a care team. And making sure that your healthcare professionals know who's kind of on that team, who they can call. And then maybe having like a family meeting or a care team meeting to say, if something were to happen to me, here's how I'm going to, we're going to try to make sure this person's notified first. I would make sure that in your phone, that whoever is kind of like your main people on your care team, that they are part of your emergency contacts. Because, say you were out and about and you fell and have been unconscious, anybody can find your emergency contacts in your phone if you have them set up. So that's like number one thing. What are some other kind of practical tips that you would offer to caregivers in case they have their own health crisis, or resources?
Yeah. Have the really basic, important information, update it regularly, check on it regularly, that make sure that it's updated. Meds list, because doses just change, things like that. The numbers of all the basic providers for the person you're caring for, definitely PCP, neurologists, etc. Make sure that this information is easily accessible, and that make it as simple as possible for those who are on this advocacy team or care team, and say, hey, listen, I keep all of this in this one place. All you have to do is open this one document, or go into this note on my phone, or whatever the case may be, or go to my house and you'll see this folder. Make sure that's easy to find, simple. And what I do with appointments is I always set the appointment in my phone when I'm standing at the desk for when we're scheduling the next appointment, right? I assume that the caregiver is attending most of the appointments, if not all of them, with their dementia loved one. And I use a different color in I use the iPhone calendar. I use a different color that is devoted specifically for health appointments. And I don't use that color for anything else. And I check it every Friday morning to see what the next week's appointments are in case I need to reschedule or cancel. And I check it again on Monday just to see what my week is like, right? And I do that as a patient. And when I go to appointments with my mom, I will put hers in my phone as well, right? And so really something simple like that. You're often in charge of medications. Set alarms for your medications. My alarm goes off every morning and every evening at 8 a.m. and 8 p.m. to take my meds. Sometimes I'm busy doing something, so I'll continue hitting snooze until I've finished taking my meds. Now, again, you're going to be the one who's doing that as a caregiver, so do the same thing. Just these really simple things that are going to hold you accountable, because medication compliance or non-compliance is a huge issue. And whenever I save all my physician's numbers in my contacts list, and then there's an extra notes section at the bottom, extra information there as I need it. Sometimes my physicians will give me their work cell phone number. I always ask people, hey, what's the best way to reach you? Is there a patient portal? Do you have a personal line I can call if I have a quick question? Or I talk to your nurse, whatever the case may be, make sure you have that information. And then I would just leave, going back to the beginning of what I was saying, make sure the information that your care team will need to have is, it needs to be like one document that has all these where they can find the other things, right? Just the simplest instructions possible. And then that one document, one page document will say, this is where you can find a list of the meds. This is where you can find this or that. And, if things are getting acute, or if there's a month ahead where there are a whole lot of appointments, or like you said, you have a surgery or something coming up, that's when you meet with your care team and say, hey, I'm going to be out of commission for this amount of time. Let's come up with a plan, and let's plan that in advance. Get people on the calendar, make sure they put it in their calendar, it's in your calendar, et cetera. Some really simple things like that most people don't think of. Those are just some things to come in mind. Those are what I usually say to when I'm working, with patients or caregivers. And that's not everything I say. There's just a few things.
Right. And the most important thing is make sure you don't have them locked away in some safety deposit box. Because it's a key to, and no one can gain access to.
Right. Yeah.
Making sure that you have your financial, your legal paperwork in one place, and that there are clear directions about where to find those things. So if someone wanted to get in touch with you or work with you in the future, like how would they do that?
My website is thesmartpatient.com.
Okay.
And that's where I have a different page, one for patients, one for caregivers, and one for providers. And I do speaking and one-on-one consultations with families. I'm also on LinkedIn, Jacob Evans Kendall. And I post a lot of content there. So yeah, I would check those two out.
Okay. And that's actually how we got connected, through LinkedIn.
Yes, indeed.
All right. Well, thank you so much for being here with me today. If you got value out of this episode, please like it, share it with anyone else who might find it helpful. And thank you so much for being with us today, Jacob.
Yeah, thanks, Melissa. Enjoyed the conversation.
So thank you so much for joining Jacob and I today. If you'd like to be part of my community and continue to learn more about aging, age-friendly initiatives, and Alzheimer's disease and related dementias, don't forget to drop by my website at melissabphd.com to grab your free podcast insider guide. This is something new. So even if you've been to my website before, pop over there and you can grab the podcast insider guide. You can also join the podcast private community on Facebook. It's called This Is Getting Old, Moving Towards an Age-Friendly World. Because all podcast insiders right now are being invited by email each week to join me for the live recordings, either in the private Facebook group or just using a Zoom link. So I hope you'll stop by and grab your free guide, and then keep an eye on your inbox weekly for those special insider-only invitations. If you found value in this episode, please hit the like button and share it with someone else that could find it helpful. Hit the subscribe button and turn on your notifications so that you're alerted when the next episode comes out, which is every Tuesday at 11. And so until next time, be well.